Now stay tuned for PTG TV's Pulse on America, where we bring you the latest in educational, consumer, sports, and business information that's right for your lifestyle.
Welcome to this edition of Pulse on America. I'm Wayne Stofsky. Born between 1946 and 1964 and making up nearly a third of the U.S. population, America's baby boomers are finally starting to turn 60. As this trend-setting group of more than 76 million continues to age, change is definitely in sight, especially when it comes to health care. With this in mind, our guests today are Val Halamandiris, President of the National Association of Home Care and Hospice in Washington, D.C., and Arnie Berkianti, Chief Executive Officer of Celtic Healthcare, Inc., based north of Pittsburgh in Mars, Pennsylvania. Val, as America's baby boomers grow older, what kinds of changes can we expect to see in the healthcare industry?
Well, you have 77 million Americans who are going to reach the retirement years all at once. They're going to need help. They're going to need help to remain in their own homes, need help to be independent. They're going to need the services of nurses and home health aides. Home and community-based care is going to be the most important part of what they need.
What is NAHC's stance on home care?
Well, we believe every American is entitled to stay in their own homes. Nobody should be placed in an institution. We think home and community-based care is the last great civil rights battle. We also know home care is important not only because it saves money. It's a lot less expensive than institutional options. It's important because it keeps families together. Home care is about dignity. It's about being in your own home, being comfortable. And we all want that for our parents, for mom and dad, and sooner or later, we're going to want it for ourselves as well.
Arnie, as the founder and CEO of a leading home health care service provider, what is your vision?
Our vision is to improve the quality of life for our patients and their loved ones. We want them to be as independent as possible while keeping their dignity. We also want to be as efficient and as effective as possible for all those involved in the case, including the doctors, hospitals, assisted living facilities, all of their staff, as well as our staff providing the home-based care.
What kinds of services does Celtic Healthcare provide?
We provide a full continuum of home care services through the whole aging process through end of life, including things from life-altering events such as surgery, falls, depression, and obviously chronic conditions like diabetes and congestive heart failure.
From geriatric care managers and private duty caregivers to physical, occupational, and speech therapists, and from medical nurses and certified mental health nurses to wound care specialists, the organization is dedicated to meeting the home health care, rehabilitation, and living assistance needs of its customers. Arnie, what differentiates your employees?
Our employees are phenomenal. We've been able to attract and retain some of the best talent in the industry. And we take pride in having a high retention rate and a low turnover rate. At Celtic, we abide to a set of core values that include accountability, mutual respect, teamwork, integrity, and service excellence.
What is Celtic Healthcare's approach toward care?
Our approach towards care focuses on team effort. We integrate the services from nursing to therapy, and we focus on continuity from the beginning of care through the end of care, with the same person communicating to the family, the physician, and everyone on the case. And we use case conferences to identify additional needs of the patient, thereby able to implement and provide the best care.
Your company focuses on technology. Describe the Celtic Integrated Business System and how it helps your patients and clients.
CIBS, Celtic's Integrated Business System, was developed to improve business and healthcare inefficiencies. It enables our nurses and therapists to go in the house with a laptop computer with a wireless internet access to gather information and to care for the patient. In the end, it leads to more face time with the patient and better outcomes. 75% of the time in home care is reported to be on documentation. Using CIBS, we've lowered that dramatically. We feel that's a sustained competitive advantage and allows us to provide the absolute best care.
To learn more about this comprehensive healthcare service organization, visit www.celtichealthcare.com or call toll-free 800-355-8894. That's all for this edition of Pulse on America. Thanks for joining us.